Hello, viewers, and welcome to All Things Politics. I'm your host, Bub. Let's get right into it. The nation is faced with the outbreak of the measles, a virus that was supposedly eliminated back in 2000. Since 2022 through 2025, the measles disease has reemerged and is spreading rapidly through the nation. South Carolina, Utah, and California, to name a few, are realizing the resurgence of the virus. And with the Trump administration's leaving the World Health Organization, which was established back in 1944 as part of the United Nations, U.S. health officials questioned if the departure from the Global Health Group was one of the most penny-wise and billion-dollar foolish moves the administration could have made. To aid in understanding what this means for the nation, health-wise, we're going to run a clip courtesy of PBS.org NewsHour on this issue. And they'll be able to shed more light on this. So let's listen to what they have to say about this.
One of the world's most contagious diseases was declared eliminated in the U.S. more than 25 years ago. Today, an outbreak that started last year is continuing, even as the U.S. officially ends its membership in the World Health Organization. Stephanie Sy explores the ramifications and the reasons behind the outbreak.
Measles cases have been skyrocketing since last year. Take a look at this chart. In 2023, there were just 63 cases. That number quadruples by 2024 to more than 280 cases. Then last year, a huge spike, 2,240 cases. We're only 3 weeks into this new year, and already 416 cases have been confirmed.
If you ask me, that's almost at an epidemic level proportions. Remember, COVID started something similar to that. And before you knew it, there was this, this epidemic of COVID. I don't think we should, it's nothing to sneeze at to think that, okay, you only have about 2,300 cases of the measles nationwide, and that being something to worry about. I beg to differ. I think that because it's at this level now, and just in this month, the levels have risen, expeditiously. It's something to be concerned with.
Outbreaks in South Carolina and along the Utah-Arizona border are jacking those numbers up. All this as vaccination rates continue to decline, and that accelerated during the COVID pandemic. Caitlin Rivers, an epidemiologist at Johns Hopkins University and author of Crisis Averted, The Hidden Science of Fighting Outbreaks, joins us now with more. Caitlin, thank you so much for joining the NewsHour. So more than 200 measles cases were confirmed in just 1 week this month. Are these outbreaks likely to stay relatively local, or are we moving toward a point where the U.S. could see a widespread outbreak?
We are seeing that some of the larger outbreaks like that currently centered in South Carolina is being exported to other states. And the longer these outbreaks spread, the more opportunities there are for the virus to travel. That being said, public health officials are working very hard to contain them and stop transmission. But there have been a lot of cases in the last year, and I do expect that to continue in the year ahead.
Again, if you think about it, there's really no way to stop the spread of it. As long as people are traveling up and down the roads, flying planes, for business appointments, whatever, there's this risk that this can spread even further than what we're seeing it do now. I don't think it's something that should be taken lightly. Like I said, measles, a very discomforting disease, to say the least. Mostly children and old people suffer from it. So it's something to think about. Here we go.
Who is most vulnerable in these outbreaks?
People who are unvaccinated are by far the most vulnerable. Around 94% of cases found last year were in people who are unvaccinated. And so the strongest protection to prevent infection is that MMR vaccine.
We've been hearing from parents of babies who are getting measles. They are those that may not be vaccinated yet, or the vaccine may not have taken full effect yet. And then there's the question of the elderly and whether they should be getting vaccine boosters at this point. What do you think?
It's true that infants who are too young to be vaccinated, people who are immunocompromised, they're going to be at higher risk. And that's why it's so important that we as a community take all of the steps that we can to prevent transmission, because stopping transmission overall is the best way to protect those people. Now, older adults is a little bit of a different story. A few decades ago, it was the policy that people would only get one MMR vaccine. That provides about 94% protection from infection. That that second dose, brings up the level of protection to closer to 97, 98%. So if you are older and you are considering getting a second vaccine or wondering if that's right for you, one thing you can do is ask your doctor to check your titers, check your blood, and see whether your immunity to measles is high enough. If not, they may offer you that second dose.
I think, though, part of the problem with that in terms of being vaccinated or people getting these vaccination shots is that there's no trust in the government in terms of the people's health. Are these vaccinations safe? Are they really useful? One, she just said 2 vaccinations. One covers up to about 94%, and the second dose only takes it up 3% or 4% more. Not a 100% vaccination to prevent measles, mumps, and rubella. And that's the vaccination MMR, measles, mumps, and rubella. But I think it's the people's faith in the government's health department. There's no faith, no trust. So I think this is why we see low vaccination rates, especially amongst adults.
You talked about the local and state response to containing these outbreaks, but I want to talk about the federal impact. The chair of the Federal Advisory Panel on Vaccines, himself a pediatric cardiologist, has said in just the last few days that the polio and measles vaccines should be optional, including at schools. What is your reaction to that?
That's really not the role of the Advisory Committee on Immunization Practices. They do not have the power, and in fact, the entire CDC agency does not have the power to require anyone to get vaccinated. What they're meant to do is provide the best advice to the American people about how to keep themselves and their communities safe from infectious diseases, and I'd like to see them get back to that in 2026.
Is that the best advice, to make these vaccines that have long protected public health optional?
Absolutely not. There's no question that the measles vaccine, the polio vaccine, and in fact, the entire childhood vaccination schedule does good. It is good for people and communities because it prevents preventable infection. But what's at issue here, I think, is mandates.
I don't know. And I'm not an epidemiologist. But it's just something about these vaccinations that they will insist that we take. Why is there such an insistence? Why are they insisting that we have these vaccinations? A lot of people took the COVID vaccination, and as a result, a lot of people still caught COVID, and others still, as a result of the vaccination, died. These vaccinations aren't foolproof. I would just like to say again, I'm not a professional, but it's more my opinion than fact. But I've been living my whole life around people who's been vaccinated, or who have not been vaccinated. And I tell you, growing up, my mom refused to have us vaccinated. We did not get vaccinated for measles, mumps, rubella. We didn't get any of that stuff. And I can never recall having the measles or the mumps. Again, I think it's an issue of trust. It's the vaccination hesitancy has a lot to do with trust in the government, trust in the medicines or the vaccinations they're pushing for people to have or to take. Something about that may be the reason why we see, or they are quoting such low numbers on vaccinations.
And I want to underscore that the federal government does not make vaccine mandates. They do not have that authority. And so I think it's a red herring to pit individual choice against vaccine recommendations, because individual choice is not an issue here.
Whoa, what do you mean? Individual choice is not an issue. Whose choice is it if it's not?
We've heard quite often that decreasing vaccination rates can be attributed to vaccine hesitancy. But Caitlin, you've pointed out that equal attention should be paid to healthcare access and affordability. Expand on that.
There's no question that there is rising vaccine hesitancy, and I think we're right to think about that and to worry about that. But when you look at which demographic groups have lowest vaccine coverage, it is people who are uninsured. And so I think access and affordability needs to be on the agenda when we talk about ways to increase community vaccine coverage.
But is that a means, or my thought processes is working here? Is that just a means then to make sure everyone gets vaccinated? Whether or not it's a real health issue or not, what's the push? Why is there such a push for citizens, American citizens, to receive vaccinations? I just think it's something about the whole vaccination process that isn't understood and should be understood before we allow ourselves to be injected with substances we know nothing about. Yeah.
The U.S. at this point may be on the path toward losing what in your field is called measles elimination status. How big of a deal is that, and what would it mean?
It's really a sign that something has gone wrong in our public health system. Measles was eliminated in the United States in the year 2000, so it's been over 25 years of maintaining that elimination status.
I think what's wrong in the public health sector, or in this country especially, is the fact that public health is a business like everything else. If you can't afford the right type of medical care or coverage, you just don't get it. And based upon the government's way of looking at that, that's okay. Whatever Obamacare had provided for the people in this country, it was way better than what you see now. Though I think the Obamacare policy or the program had its limits, skyrocketing out-of-pocket costs, there were a whole lot of other factors, but that was there. It was in place and people actually did use it. The fact that there's nothing in place now, that just goes to show, or should goes to show, that public health care or health care for the public is not a priority for the United States government. Again, you have too many lobbyists in the medical field who lobby against free medical care. That's why we see what we see.
And I think we'll likely lose it in the year ahead. Now, I want to make the point that a vast majority of Americans are vaccinated and support vaccination. And so it's really this minority of people.
I don't know if that's true on both ends of that question. The vast majority of Americans are vaccinated, as well as the vast majority of Americans support vaccinations. I don't know if that's true. I don't know if that's true. You might be able to say some demographic, some ethnicity or ethnic groups support it more than others. But to say that the vast majority of the country or the citizens in the country support it and have their vaccinations is not the truth. And I don't care about no data and stats. They can always be doctored.
People who are thinking about ways to erode our vaccine confidence and reducing community access. And unfortunately, we are seeing the effects of that. But I also want to contrast that with the point that vaccines are very popular.
The U.S. left the World Health Organization officially this week. I'm curious whether you think that might affect the measles outlook, either domestically or globally.
Measles is probably not top of the list of places where we will see the impact of our withdrawal from the World Health Organization. But regardless, it's clear that that is a move that will reduce the United States' preparedness for epidemics and pandemics. The WHO is a main way that we receive information about what is happening in the world. And we provide information and support as well. And so I think it's really a mistake to sever those ties.
That is Caitlin Rivers, an epidemiologist and author of Crisis Averted, The Hidden.
All right. That piece, I do want to expound upon that for a minute right quick. Healthcare here in the United States, everyone knows, is a farce. Again, if you don't have real money, then there's no way that you can have decent and on point diagnosis in terms of what's wrong with you, and that just doesn't, we're not just talking about now vaccinations, we're talking about healthcare in general. The measles. The reason I think there's a resurgence or the reemergence of the measles is because I think the health department, in terms of how it looks out for the citizenry, it is in shambles. They, there's no foundation that they stand on. And again, well, there is a foundation that healthcare in here in this country stands on, and that's capitalism. If you don't have any money, then there's no way in the world you can receive the type of health care you need as a human being, especially in this day and age when most of the foods we eat are GMOs. You have free radicals more rampant now. Stress factors are up. Whole lot of other things, man. All kind of diseases. People are starting to experience diabetes, high blood pressure, low sugar. All these issues, I think, are the cause and effect of a healthcare system that is not non-compliant, but non-existent. Again, if you don't have the money, then you will not receive health care above par. Those are the facts, And anybody, want to come in and comment about this issue, please do so. This is All Things Politics. We appreciate you coming in and taking time, out of your day to listen to what we have to say. Please like, share, comment, and subscribe. Most definitely subscribe. And once you do, hit that notification button so that you'll know we're posting new material in the world of politics. All right. Take care of yourself, everyone. And thank you for joining us.